Hi guys, we're here today with Carolina Romero and myself, Dominic Pompili. We're going to be going to get through a few self-myofascial release techniques using the foam roller. First, we're going to start with the subscapularis muscle. It is a very powerful muscle, and if too tight, it's going to restrict the shoulder and also the neck from proper motion. So Carolina is just side lying on her left, pretty much almost her armpit area, and just maintaining her body weight pressure in there. And what that's allowing is deep pressure releases tight tissue. When that area is nice and loose, the scapula is going to move well, and therefore the shoulder is going to move properly and optimally as well. She would stay here for about 20 to 30 seconds, making sure she's not getting any pain or numbness or radiating pain down into her arm and hand, and then she would go ahead and rest. The progression for her would be she can open her palm up and slide her hand backwards, and then slowly turn her palm down, and she would come all the way back over. Okay? Yep. While she's moving this arm, she's maintaining the pressure there. It's going to allow a little bit more release in that area, and then again, better outcomes for motion at the shoulder. Hi guys, we're going to go through a self-myofascial release technique now of the thoracic spine, which is imperative. We have about 33 degrees of rotation of thoracic spine. We want to make sure there's no restriction there. It's going to definitely allow us to get that rotation that we're going to need to finish our golf swing properly. So Carolina is here with her hands behind her head. She's using her core and her glutes to actually help add some pressure to that thoracic area, her upper back, and she's going to look to drop her elbows down towards the floor while she's maintaining deep pressure here. Now this is hard. She's very strong, so she's able to lift her hips up off the floor. If she needs, she can drop her hips down and just maintain her body weight pressure on there to her tolerance. Again, she would stay in this position for approximately 20 to 30 seconds, making sure it's tolerable, there's no pain, but she is going to feel a deep stretch and release in that area. Hi folks, we're going to go ahead and demonstrate what we call a self-myofascial release to our iliotibial band. Some people say IT band. A lot of people have IT band syndrome. Key thing is if it's too tight, it's going to restrict knee, hip, and low back motion. Therefore, we want to effectively release the area, especially for activities like golf. So right now, Carolina is sidelined on her left IT band, and she is just approximately on the upper portion there. Again, she's going to maintain pressure there, stay in each spot. She'll find the hot spot, or what we call a tender spot. She's going to stay on that spot for about 20 to 30 seconds. Let the deep pressure release that tissue. Once she's accomplished that, she will then roll downwards and go closer to the knee. And she will begin to go through the whole length of that fiber. The fiber comes from the upper portion of the hip all the way down to the knee, and it affects both joints. So therefore, you want to make sure that you effectively release it so we're not going to have any further dysfunction. A progression for this would be for Carolina to put her left leg on top. What she just literally did is she added body weight, which is going to add pressure, add intensity. It can also add a deeper release, but it may be more painful. Therefore, we have options. Guys, we're back, and we're going to go ahead and just demonstrate what we call self-myofascial release to our quadriceps area. Again, the difference before, the IT band is connective tissue, the quadriceps are muscle, so they will respond and feel a little bit different. This should be pretty easy in the realm of self-myofascial release for the quadriceps because it is a big, deep muscle, and we have a little bit more room to give than just stress in that area. So she's going to stay on that for about 20 to 30 seconds, similar to what we've done in all the other releases. And when need be, she will move after she's felt that area has been released and it's comfortable. Again, the range we would look for is to her to come to the upper hip portion and just above the kneecap. And it's done to her tolerance. We don't want any pain. Alright folks, we're back and we're demonstrating actually using a small medicine ball that does have some give to it. We're going to use this for that myofascial release into a muscle called the psoas. It's in the front portion of the hip. It's very powerful, and if restricted, it can cause a lot of problems and dysfunction to the hip and lumbar spine. So before we begin our golf program, we look to release this similar to what we've done with all the other tissues. She is now just, there's a little bone there, and she just slides right inside that there. and just inside the hip area. She's going to stay there for about 20 to 30 seconds. Again, this is a little bit more invasive and intense, so I would just be careful in doing it, but it is highly effective when done properly. You stay on there for 20 to 30 seconds. You don't need to move or roll around. You're just going to stay there. When done, you would go ahead and get off the ball. Folks, we're back, and we're going to demonstrate again, myofascial release for the gluteus medius muscle. Carolina is sitting on an 8-pound medicine ball. It does have a little bit of give to it, but not much. And what she has done is she's crossed her leg in what we call a figure 4 position, and she's literally opening up her hip here. When she does that, she's able to open up that area in the muscle to allow it to be released effectively. She's going to stay on that spot for 20 to 30 seconds. Feel that good release. I don't want any numbness, tingling, anything like that. Any pain, she gets off and stops right away. The key thing, keeping pressure in her abdomen to help stabilize her low back as well. Hi folks, we're going to go ahead and just demonstrate what we call myofascial release. This is to the pectoral minor muscle. It is a small muscle underneath our clavicle. It also supports and attaches to the upper ribs. When it's restricted, we're going to have shoulder pain. We don't want that, or dysfunction. So Carolina is just leaning into there, and her body weight, again, into the ball is creating pressure, and that pressure is going to help to lengthen that tissue. Deep pressure releases tissue, especially tight tissue. Notice she's staying there and just holding that. If she wants to progress, she can slide her arm up. Okay, and what that's actually going to do is open the area up and get a little bit more invasive into that area. And she can get a little bit more pressure in there. If she'd like to progress, she would lean more body weight in there or back away if it's too intense. Again, she's going to hold that for 20 to 30 seconds. She will feel a good stretch. If there is any pain, I would definitely stop right away.